Hello, everybody, and welcome to this first webinar for the Rationalist Society for 2022. My name is Dr. Meredith Doig. I'm president of the Rationalist Society, which is Australia's oldest free thought group. And wherever you are joining us from, and we do have people from Tasmania up to Queensland and Western Australia across to New South Wales, this meeting is taking place on the lands of the Aboriginal and Torres Strait Islander peoples, and the RSA acknowledges the traditional custodians of this country throughout Australia, and acknowledges their connections to land and sea and community. So tonight we turn to what might seem to be an emerging issue, the mental well-being of our children. But I think our guest speaker will tell us that it's an issue that's been around for a lot longer than just the pandemic, although the COVID and the lockdowns may have brought it into much greater prominence. Dr. Marilyn Campbell is a registered teacher and a registered psychologist. In the past, she's taught in infant schools, primary schools, secondary schools, as a teacher librarian, and also as a counsellor. And she has supervised school counsellors. But nowadays, she's a professor at the Queensland University of Technology with clinical and research interests in the prevention of and the effective treatment for or intervention for anxiety disorders in young people. She has a particular interest in bullying and in cyberbullying in schools. So the way that we will do this is that Marilyn and I will chat for about 30 minutes, and then we'll open it up to questions. Now, there have been some questions that have been sent in beforehand during the registration, so we'll go through those. But please feel free to add your questions in the chat box as they occur to you, as Marilyn and I are chatting, and then we can read through those as well. As always, I do try to finish on time. I'm very conscious that Marilyn and anybody who's joining us from Queensland, it's actually 6:30, so you probably have not had dinner. So I will try to wrap this up at 7:30 and let people get on with the rest of their evening. So Marilyn, let me just open by saying you've made a career out of studying children's mental health and mental well-being, including issues like bullying and cyberbullying and anxiety disorders generally. So why don't you sort of bring us up to date? What is the mental health and mental well-being, or let's say the mental health, but the mental well-being of Australian children these days? What's it like?
Well, I suppose, Meredith, the short answer is not very good. So we know that about 20% of primary school children have some kind of mental ill health.
1 in 5.
Oh, yes. Oh. And 32% of secondary students have problems in this area. So that's, I suppose, we're saying, well, that's probably because of COVID or because of other things that are happening in our society. But unfortunately, this has been going on for some time, because those figures, which are the latest figures that are available, come from the Young Minds Survey, which was conducted in 2013 to 2014. The Young Minds Survey is a Australia-wide, stratified, randomised sample. So it's the best kind of information it's conducted by interviews.
Mhm.
They have a 6,000 participant numbers, so it's very large.
Mhm.
People in Western Australia, such as Stephen Zubrick, David Lawrence, and forgot the other guy's name, Michael Sawyer.
Mhm.
They are the ones who usually take this information, which is a huge amount of data, and they continue to publish right up until last year data from that study. So you can see that it isn't just a problem that has occurred in the last 2 to 3 years.
Mhm.
Worldwide, there's been lots of studies also that show that there has been a slight increase in mental health problems in young people worldwide. But that's only been a slight increase.
Mhm.
It's about probably only about 1 to 2% of children from 1980, I think, to about 2016. Now, that doesn't really show what it's like in Australia, because the data from Australia is more of a high-income country.
Mhm.
In that, we know that high-income countries have had an increase in anxiety disorders, depression, clinical depression, and self-harm.
Mhm.
That's been shown only in high-income countries, so UK, USA, Australia. And that has been increasing, and especially for girls.
Wow. So the worldwide data that you were referring to at that point, does that cover OECD countries only, or is it developing countries as well?
Developing countries as well.
And is there a difference between young people in developing countries and the more developed countries?
Very much so. So I suppose when you are living in an underdeveloped country, even though I don't like to use that word, you are more concerned with basics of safety and food and shelter. And they are not, the young people are not responding to say that they're anxious or they're depressed or they have mental health problems because of the circumstances in which they're living. So I think, I mean, that was a study in 2017 by Pottenbury, and she looked at, yes, all of the countries, not just the OECD, and there were huge differences between developing and developed countries.
Certainly, it seems to be an issue where the children in richer countries, ironically, seem to be less happy. Could we say that? Less happy than their counterparts in poorer countries?
We could draw that assumption, but it would be an assumption.
Yeah, right. And so how have we got to this state of affairs? I mean, you know, if I think back to my childhood, and I suppose everybody who is listening to this webinar can think back to their own childhoods, and maybe it's selective perception, but you seem to think that we had a happy childhood, despite, you know, there were ups and downs and so on and so forth. My parents divorced, and there were certain things about my childhood that were pretty difficult. But overall, you remember it being quite a free and happy childhood. And yet, I don't have children myself, but for people that I know who have children, there does seem to be this widespread anxiety amongst children. How do you think, or what does the research say about how we have got to this situation?
Well, this is supposition because there are not very many studies that take all the variables, as you would know, into account. So one of the things it could be is that we ignored mental health problems of children in earlier generations.
Mm-hmm.
That if a child was unhappy too bad, we didn't take any notice of it.
Or they just got over it.
Could be. So are we more aware of it now? Are we, as a society, thinking that, oh, this child's behaviour has changed, I wonder what's going on wrong? So maybe we had mental health problems more than we recognised before, and it's just a recognition of things. That could be one explanation.
Mm-hmm.
Maybe some people say, well, we're too soft on kids now. We were more resilient. We went out, we climbed over the trees. We weren't scared. Of course, we'd fall out and break our bones. And so what? That was all part of childhood. We're just namby-pambing the kids now.
Wrapping them in cotton wool. We're
over-parenting them. And a couple of generations ago, they went through 2 world wars. If you're going to get killed, you're not going to be worried. You might be anxious about being killed, but so is everybody. So when there's huge disasters, then people don't seem to report mental health, but then surveys aren't taken, also in war. So it's another hypothesis. Maybe that could be the reason.
I just encourage everybody who's listening to this, if they do have views about their own childhood versus the sorts of childhoods that children are having to deal with these days, put your questions or your comments in the chat box and we can get around to those in due course.
I also think that there are studies which show the prevalence of mental health, and of course those studies often aren't comparable. So
aren't or are not?
Are not comparable. So lots of people use lots of different measures. They like the Young Minds is always interviews, whereas some people do surveys. So maybe there's changes in help seeking in our society. So people say, well, more people asking for help, therefore there must be more mental ill health if they're asking for help, but maybe they didn't ask for help before. We also know that there's family transmission of mental ill health. We know genetically now that 30% of mental ill health is actually genetic. 70% is still environment, but we know that that's actually genetic. So there could be poor parental mental health.
Right.
And then the environment for the children is obviously getting more mental health problems as well. And it could be parental maltreatment of kids. We know that drug taking among parents is much higher than it has ever been. And those children who are born to parents who are drug takers are often taken into care. And then we know that those kids in care are incredibly vulnerable and have more mental health problems. So we also know that more kids with disability are surviving because of our medical advances. And we know that that kind of mental ill health is more prevalent in children with a disability as well.
Mm-hmm.
There's also drug taking amongst young people, which leads to psychosis.
Mm-hmm.
There's bullying, which is increasing children's anxiety and stress. We
And
know
Marilyn,
that.
I'm sorry to interrupt, but I know that you made a particular study about bullying. In your experience or in your observation, is that increasing or decreasing? How are we managing it?
It's saying exactly the same for the last 50 years.
Wow.
We are not making any, I mean, I'm talking very, very globally, but we are not making any inroads. Whereas before it was a childhood rite of passage, what didn't kill you made you stronger, it was character building. Now we know from the research done by Dan Olweus and Peter Smith in the 1970s and 80s,
Mm-hmm.
the incredible negative consequences of bullying. But, and so therefore people say to kids, don't bully. They still do. And we know that those consequences are there. But however much we're trying, we're not doing anything right yet. We are not we are not reducing what bullying is happening in schools.
I have a comment here from Phil, who says that he agrees that we have to have better ways to assess mental health today, but life is far more complicated for children today. And are they on the end of greater sources of stress? Are you able to say whether or not the stressors are much greater these days than they were?
It's like, what period are we talking about? We often look back, as you said previously, to our own childhood and thinking, well, I didn't have television when I was growing up, and I didn't have computers, and all of these things make life more stressful, but they also make it a lot easier in lots of ways. So there's swings and roundabouts for that. For my opinion, I actually think that it is parental restrictions on children, where because we have so much more information as parents, we know that a child was abducted in Western Australia. Actual abductions around the world don't seem to have increased or decreased in the last 50 to 60 years. But parental concern about abduction has increased 20-fold because everybody knows about Megan McCann, that we have this information that the media puts out, and this means that we are so much more fearful. And I was in a shopping centre a couple of years ago, and the woman had a 10-year-old boy coming out of the supermarket, and he went to put his lolly wrapper in the bin, which was a couple of meters away, and she screamed at him, "Come back here. Don't you know somebody will snatch you if you walk away?" So it's that kind of fear, I think, that it's a parental fear that makes the children more fearful. And if you doubt your children's ability, and that's shown in lots of studies of anxiety, if you doubt your child's ability to cope, they doubt themselves.
Right.
And therefore that leads to anxiety. We know anxiety leads to depression. We know anxiety and depression leads to self-harm.
So it's a bit of a vicious circle.
Well, I think it's probably not the stresses as much as parental expectations, perhaps, of overscheduling as well. my child has to do dance and piano and sport because I want them to have all the advantages that I didn't have.
Mm-hmm.
And they're given lots of things, whereas they're not allowed to be bored. They're not allowed to think, wonder what I'm going to do for themselves. So
Mm-hmm.
that could be one reason that anxiety, depression, and self-harm are increasing more, but we don't actually see any huge increases in what used to be called the psychosis,
Right.
such as schizophrenia. We are seeing younger children exhibiting some of these symptoms, but that's probably because we're better at diagnosis.
Okay. There is a comment by Tony Krins, well, question really, and that is, and getting on to the next part of your talk, what are we doing about this? Has the pastoral care improved in recent decades, and is there a difference in pastoral care between school systems, between public and private schools, for example? So what are education systems doing about this sort of increase? So I don't want to say epidemic, but an increase in mental unwellness.
Mm-hmm. It's interesting you went straight to schools.
Mm-hmm.
That if we have a problem in our society that actually means that children are involved, well, the school has to solve it.
Yes, right.
And I think that's very interesting because schooling has now changed from, I mean, it's almost like 100 years ago, 120 years ago. We've still got 9 to 3. We still have the holidays. The school day has increased. There's been no huge educational revolution at all. But society now expects schools to solve societal problems.
I suppose it's because it's something that governments can do something about. I mean, you know, it's difficult for governments to mandate or regulate parental behaviour.
Right.
But they can put money into or regulate what schools do. And so it's a convenient lever to use.
It is, and that's where children spend a lot of time.
Mm-hmm.
But we're not really radically thinking how we're going to do this. We know we have an overcrowded curriculum. We know we're expecting schools to do so much more than ever before. I mean, it would be lovely if we could change society. It would be lovely if we weren't so materialistic. If both parents didn't have to constantly work to so-called survive in our society, that we had more time to give to our children as parents. It would be really good if there wasn't as much violence and domestic violence in our society, that there was more kindness. But it's probably, as you said, not going to happen. So, okay,
well,
so
not going to happen.
What will schools do? How do we get schools to try and solve this problem? So there are many, many different people in schools, mainly in teachers. And there's a huge call for teachers to be everything to children. And a lot of the time one is. One looks after their physical and their mental health and their socialization, as well as teaching them. And to a certain extent, teachers have done that. But many teachers are drawing the line if we're saying mental health problems, because what we say in our society is that we have specializations in our work. We don't ask an architect to look after people who are sick with COVID. So therefore, with those specializations, teachers have been saying increasingly, we'll do the teaching other people need to look after kids with mental health difficulties.
So this is the teachers themselves. They're pushing back and saying, no, this is an unrealistic expectation to place upon classroom teachers.
That's right. That's
So
right.
if not classroom teachers, then
well, there's lots of support people, and that's what schools are doing. What they're doing is, in an uncoordinated fashion, putting people into schools. Now, there's been school nurses a lot of time, but they're now taking on suicide prevention, as well as testing their eyes and ears and things as we normally thought that school nurses did. There's youth workers, there's social workers, there's school psychologists. One of the difficulties is that the school is left to coordinate all these support people. We also have occupational therapists, we have speech therapists, we have, some schools have GPs who are in schools. I mean, there's a movement sometimes to say, let's have a wraparound school. Let's have all the services of the community actually in the school. And this will help. Other people say, no, or you've got to have schools who liaise with community. The problem is at the moment, of course, is the training as well, because we don't have enough child psychiatrists. We don't even have enough psychiatrists, as you would have read in the news with the difficulties with the exam. We don't have enough training for educational psychologists, who are mainly those ones who work as school counsellors in schools. We have now 3 programs, I think, in Australia left, because how expensive they are, and universities don't have the money to be able to train those psychologists.
So, Marilyn, if what you're saying is that it's not yet fully integrated, these support services not yet fully integrated into schools, and maybe that's because this is a relatively new service that schools are seeking. Are you confident that it will get better, more effective, more streamlined in the future?
Well,
or does it all depend on funding?
Well, it's not necessarily about funding at that school level. It's about funding for training to start with. And then it's about education systems looking nationally instead of always at state level to how to provide. I mean, you have Your Town, which runs Kids Helpline and Parent Line and does work in schools. You have what used to be Kids Matters and Mind Matters, which is now BU, BEYOU. So they're running programs in schools. There's lots of really well-meaning organisations who are doing all of these kinds of patchwork services for schools.
Well, that's what happens when you let the private sector loose.
Whether it's going to provide better support, whether there's going to be more coordination, either at an individual school level, at a state or a national level, it's a really hard call. I'm at the end of my career, Meredith. I'm in the cynical stage. I've seen things being tried so many times. Young people come in, are enthusiastic, and it's wonderful, but they try and reinvent the wheel. We say, we've already tried that. Yeah, I would hope so.
Well, I don't want you to go further down the cynical route. So let's. There have been there's been some comments in the chat box, particularly, and I'll Phil Need has mentioned that there is a huge, from his perspective, and he is a teacher, a huge increase in kids' mental health issues with lockdown, and a huge waiting lists at the moment to see, presumably, support workers and counsellors.
That's right. That's right.
There were some questions that were sent in when people registered, so why don't we get to those, and that will make sure that we meet people's expectations. Are you okay with that?
Yes, that's fine.
Okay, so here's a question from Julie. Julie says, Dr. Campbell, would you accept that the pressure exerted on children in many schools to consider the idea that they may have been born in the wrong body or to be trans has contributed to confusion and anxiety, particularly in those entering puberty?
I'm not quite sure what kind of pressure that there is from schools. I personally have not read or seen any pressure. If
pressure on the children in school.
If Julie means
Mm-hmm.
that it is a subject which is in the media and is a subject that could be raised at school, I don't think that that creates pressure.
Mm-hmm.
It's the same as when I try and get ethics for a study that looks at anxiety in children. Non-psychologists often raise out, oh, don't ask them if they're anxious, because if you ask them if they're anxious, that will make them anxious.
Mm.
And I think that's the same kind of pressure that Julie might be talking about, because I know when I ask kids if they're anxious, and I explain it and I talk to them, they go, oh, duh, oh, of course I'm not, I don't think like that.
Right.
Or if they are, they go, oh, thank goodness somebody has recognized it.
Right.
There's no pressure. You don't make kids anxious. It's the same with talking about safe sex. There are many, many studies that show this does not lead to promiscuity. It does, just because you talk about something with children, they don't necessarily feel pressured. So no, I disagree that there was any pressure. And if it's talked about, I think that that's a good thing. Kids already see it on the media. They want to know about it. It'd be good if they could ask their parents and their parents could talk about it first.
Mm.
But often parents won't talk about anything sexual with their children. They feel too embarrassed, and it is left up to the school to take that part in their education.
Mm-hmm. Okay, let's move on to a question from Julia. She says, as a secular activist, I'm keen to hear Dr. Campbell's views on school chaplains and the recent exposure of damaging religious beliefs in some Christian schools. I think she's talking about City Point College, a number of whom also have access to Queensland's public schools via religious instruction. So your views on school chaplains and damaging religious beliefs in some Christian schools?
Well, I think there's kind of two questions in that, and two very large questions, Meredith. The first one is the chaplaincy issue in schools, and the second one is religious instruction.
Mm-hmm.
So I'll talk about chaplains first.
Mm-hmm.
I'm the media spokesperson for the Australian psychologists and counsellors in schools, and we have written many submissions to the Mental Health Productivity Commission and others, saying that we do not support the current funding for chaplains in schools. We'd say this on two fronts. The first is that there are many options for parents who wish their children to be brought up in their own religious faith.
Mm-hmm.
And those schools are available to those people. State schools are supposed to be secular schools. It is, even I believe, I'm going to say more wrong, I couldn't think of something else to say, to put chaplains in schools, even than religious instructions, because at least with religious instructions, parents can say yes or no.
Right.
As a chaplain in the school, you do not have to have permission for your child for that chaplain to speak to them. Now, we know that there are only Christian chaplains. So there's only one but religious faith being represented.
And is that, sorry to butt in there, but is that in all states of Australia or mostly in Queensland that you're familiar with?
No, all states.
Mm-hmm.
Only when Julia Gillard, who was professed atheist, when she was Prime Minister, the scheme was allowed to put so-called secular youth workers from that scheme. But that scheme is run by the Scripture Union. They pay for the majority. See, it only costs the school very little money. Each school actually has to pay for that chaplain to be there, but very little money. Because it's subsidised heavily by the Scripture Union and also by the government. So that means that they are Christian people and the school is supposed to be secular.
Right. We're having a bit of sound issues with you, Marilyn. Can you get a bit... Try again.
I can't hear it.
Oh. There we go. We're having a bit... Can you hear me now?
Yes.
Yeah. You were fading out a little bit.
Sorry, there's a thunderstorm.
Oh, right. Okay.
Queensland wet season.
Right. Maybe that's what it is.
Go away. Can I speak louder?
Yes, that's fine. Yes, thank you.
Okay, so we oppose chaplains who are only Christian. We, in fact, would oppose chaplains of any faith being in a school to assist children with their mental health. So that's the first reason that we oppose it. The second reason is they have no training. So what children are incredibly vulnerable for their mental health while they're at school. And you need a fully trained psychologist or a fully trained counsellor who has been a teacher themselves. So most school counsellors are teachers and psychologists or teachers and counsellors with master's university training. Chaplains, up until a few years ago, did not have to have any training whatsoever. They now have to have a TAFE certificate with young people, but I think it's only a certificate 3. That does not qualify them. Now they say they do no counselling. I can't understand how they differentiate counselling and talking to a child who has mental health problems.
Yes.
I just can't understand that. And we know that Scripture Union and the Christian religion says that they must proselytize, that they must spread the word of God. And so how like for me and for the organization that I represent, we are incredibly opposed for those reasons.
Right.
Now, for religious instruction, we also believe that when religious instruction was introduced to schools many, many years ago in Australia, they weren't the amount or the number of faith-based schools that were available. It was a much more so-called Christian country 100 years ago. But now we believe, not have religious instruction as part of the school day. If parents want their children to have religious instruction, it should be like a drama club that they do at lunchtime or after school. It shouldn't be taking part of the school day. It could be an offering of an extracurricular activity where parents say, yes, you can stay after school and have this, or you can have at your break time instead of playing chess.
Like an elective.
But there are so many parents who do not want to have their children have religious education, and therefore they don't, and they are kept in rooms where teachers have to mind them, don't do anything else with them, and that's a wasted time period.
Marilyn, I just want to read a couple of the comments from Alison. Our high school PNC donated $15,000 a year to pay for a second chaplain. The other chaplain is funded by the chaplaincy federal funding, so it's the National Schools Chaplaincy Program. She says, Stephanie, thank you for your insight. Stephanie says, I've been working as a school chaplain for over a decade. If I were to speak to a student more than once, I did have to have parental permission. I've been working as a chaplain, a Christian myself, but support students for all faith beliefs. I only ever work under direct supervision of school guidance officer and principal. So Alison, thanks, Stephanie, for that insight. And she says, are you saying you do not speak to children after the first time, or not at all? And Charles says, with respect to school chaplains, it's important to ensure that we don't take the extreme examples as the measure of all chaplaincy. And I don't think you're doing that, Marilyn. I think you're speaking more from the principle of having chaplains rather than the either good or the bad behaviour of individual chaplains.
That's you can have good and bad counsellors. You can have good and bad principals. You have good and bad in every profession. I am not saying that there aren't some people who are chaplains in schools that the schools wouldn't want to lose because they are doing a fantastic job. It's not on an individual level that I'd be speaking. It's only for the principals that they're not trained as sufficiently as we would like, and they are of a faith that they are actually saying, I am a chaplain.
There were a couple of questions that came in during registration, which I think you've already answered. One of them from David was about, can you not hear me well? Yes? Marilyn, can you hear me okay?
Sorry, the rain.
Oh, it's your end.
I'm having difficulty hearing you.
Okay, I'll try to turn this up a bit. David asked whether there is any non-religious chaplaincy.
A non-what chaplaincy?
Non-religious.
Yes, under Julia Gillard, there was,
yeah,
but not anymore.
Not anymore, yeah. I think that in Victoria, I know there have been one or two who've managed to get employed, but the system is really doesn't encourage them at all. Can I also ask this question from Glenn, and let me know whether you can hear this okay, Marilyn? From a Muslim perspective, the most potent mental and physical risk for a Muslim child at secular schools comes from religious-based discrimination and bullying. How would you argue against the need for a Muslim chaplain suitably trained?
Well, I do not believe that a religious faith, whether it be Muslim, Buddhist, any religious faith, should be in a secular school. I believe secular actually means that it's not religious. So training is paramount, but why should you have a religious person and not a psychologist or counsellor? Psychologists and counsellors are trained so that they are not allowing their own beliefs into the counselling session.
Right.
They know how to counsel, no matter what that person's values and beliefs are. They don't put their own values and beliefs onto that person.
Whereas a religiously trained person, by the nature of their philosophy, has an urge to proselytize or evangelize the faith rather than stay neutral. Is that what you're saying?
I believe so. Why else would you want a Muslim to counsel your child?
Right.
I understand that if people have a very deep faith and that's very important to them, but I think that there are many ways that as parents, they can bring their children up in whatever faith they want. But I don't think that they should say, therefore, that other people's children should be counselled in that faith.
Mm-hmm. And Marilyn, we need to perhaps start wrapping up, but can I ask you about effectiveness of the support workers, effectiveness of counsellors, of psychologists, of chaplains? Are there studies that you know of that compare the interventions in to try to improve children's well-being? And if so, are there which are the interventions which seem to be the most effective? You're having difficulty hearing. Oh dear.
It's gone now.
Okay. So did you get my question?
No, could you just rephrase it?
Sure. Are you aware of studies that compare the effectiveness of interventions, be they by psychologists, counsellors, or chaplains?
No, there are none.
Really?
There's been no evaluation of the chaplaincy program, and certainly no evaluation of comparison in a school setting at all.
What about evaluation of psychologists and counsellors?
No.
Not there either. So this is just, it seemed like a good idea at the time.
It's like saying, I suppose, how do you compare principals running of their school. It's huge. The study would have to be, and you have too many variables to do that study of. So if you took 10 counsellors and 10 chaplains, and you'd have to have the same children, you'd have to have the same school climate, you'd have to have everything the same. It's not possible. You would only be able to, and then what would you measure? Would you measure the lack of mental health problems in the school? Could you attribute that to one person?
Right. Many different factors.
There are just too many. Like, that's why educational studies aren't very good, because teaching is more of an art than a science, and probably counselling in schools is probably more of an art than a science as well. Yes, there are basic things you need to do as a teacher and basic things you need to do as a psychologist and a counsellor. But to actually quantify those and have the same kids with the same problems in the same families and the same socioeconomic community, I don't think it's possible. All you would be able to do would be to say people's satisfaction with a counsellor or with a chaplain. And that comes down to personal qualities, not systemic, whether this is good or bad.
So what kids need are the support workers who have those personal qualities to be able, so that they can trust, the kids can establish a relationship and establish trust with the children. Is that correct?
Well, that's part of it. But of course, schools are incredibly information sharing places. And when you're a counsellor, you say to your clients, unless you are going to harm yourself or somebody else, I will not disclose what you talk to me about. As soon as you walk out as a school counsellor and the principal says, oh, I saw you had Johnny in the room, what's up with him? And if you say, I'm sorry, I'm not allowed to disclose that. Oh, well, what use are you? This is a whole school. We share information. We want to do the best for our kids. Confidentiality in schools is one of the most difficult things, because schools want to know everything. I mean, what you have to do is learn, and I teach prospective school counsellors this, that you've got to give them something, but you can't break the confidentiality of the child. But you've got to share some information with them. Otherwise, the school system doesn't trust you, even though the child does. And it's really, really difficult. It's a huge ethical dilemma.
Marilyn, I don't think we are going to come to a point where we have recommendations for how to fix this problem, because it really does seem to be a very complex one. But can I just ask you finally, and then we'll wrap up for the evening, are you confident or optimistic or pessimistic about the way that things are going in the future? Will kids survive, or are we looking to an almost an epidemic, as these children grow up into their young adulthood, of young adults with excessive rates of mental unwellness?
I have to answer, Meredith, that I don't have a crystal ball. I really don't know. I really don't know. I think there are so many well-meaning people who are trying to help. I just wish that we would have somewhere that we can coordinate more.
Right.
I almost wish we were in some ways living in a dictatorship, so that they'd say you've got to work together. So that there'd be somebody who would have this overall plan
Right.
for schools. Whereas what's happening is that responsibility is now being devolved more and more onto the individual schools. So you don't necessarily, I mean, in Queensland, we have independent public schools, so that you might want to hire 3 counsellors, or you might want 6 chaplains, and you might want a maths teacher. That's okay. You can have whatever staff you want for your school, saying that the leadership team knows their community best. I worked in private schools in New South Wales early in my career, and I must say that they were wonderful places to work, because people were of the same values that you don't necessarily get. And yet I worked in really difficult, low socioeconomic areas as a teacher in Brisbane, and they were some of the most fantastic years that I had, because we all banded together, because we knew what incredible difficulties the students were going through. So I don't know, maybe devolving responsibility onto principals, not only for the financial management, but for staffing, for knowing which people are going to be best, not necessarily that this person's got a PhD in teaching and this person's got a bachelor's, but they fit the school climate or they fit the ethos of the school. Maybe that's best. On the other hand, I also want some kind of, I don't know, not wasted money with all of these band-aids and bits and pieces on schools. So I'm sorry, I don't have an answer.
Sure, that's okay. I think there's elsewhere, I've read that there's a bit of an epidemic of stress amongst school principals as well, because of these incredible pressures coming from all sorts of different sides, and not having the time or the resources to be able to meet all the stakeholder expectations as well. But I have I'll finish with this, and I have a solution to the problem of stress in younger people, or at least teenagers, and that is, this is Doig's second famous dictum, and that is that all young Australians, upon reaching the age of 18, should be given a one-way ticket to a non-English speaking country and told they're not allowed back for 12 months. Because it's not their fault, but they don't know the way how the rest of the world lives. And they need to have that personal experience themselves. And so many young people who come back from traveling overseas, and it teaches them to be more self-reliant and to personally be able to compare what they take for granted in Australia compared to the way that many other people in the rest of the world live. So that personal experience of having to cope for yourself, having to rely on your own resources, but also to see the way that other people live from a personal point of view is really, really valuable.
I like it.
Okay, it's not going to happen tomorrow. Marilyn, thank you so much for sharing your wisdom and your insights and your observations with us tonight.
My pleasure, Meredith.
Terrific. To everybody else, can I just urge you to tune in again next month? We haven't yet finalised the arrangements for our next month's webinar, but it's going to be with a couple of specialists whose expertise is on countering all this misinformation in the context of QAnon and the far right and the militant wellness movement in Australia. So for those of you who are interested in how to avoid going down the rabbit hole of QAnon, please tune in. Next week, we will be sending out information about our next webinar. Marilyn, thank you again for your time. I will let you go now and you can have your dinner with your husband. To everybody else, thank you so much for joining us tonight, and I hope that we see you next time. Good night, everybody.